Nurses and doctors, what's the rarest or least common medication you've ever had to administer and why? Story 1. Just a med student and not sure how rare it actually is, but I've seen arsenic trioxide prescribed once for a patient with acute promyelocytic leukemia. I think another arsenic compound is used to treat sleeping sickness, but that's about the only disease it's used for these days. Once upon a time, it was the best treatment we had for syphilis. I'm a pharmacist in Australia, and I've worked in a couple of hospitals and cancer care wards. From what I've seen, we actually get quite a lot of leukemia patients requiring arsenic trioxide as part of their chemo protocol. I had 2 patients just a couple weeks ago, and I honestly never realized it was even used when I was a student. Pretty amazing that we can use such toxic compounds to treat cancers and save the patient. Story 2. I gave an old man an M&M one time when he was demanding a sleeping pill. Blood pressure was too low, so the doctor wouldn't order a real one. Worked great. Getting comments that this is unethical. Please realize that this was done with the patient's safety in mind. In the real world, hospital safety is always the first priority. Things aren't always as clean, neat, and perfect or morally sound as they are on Grey's Anatomy. Also, I've done this maybe twice in 11 years. This isn't a common practice, and it's happened in very, very special circumstances when the family has been aware and agrees and encourages it. I don't just go around lying to patients and giving candy instead of medicine on a daily basis. Story 3. Respiratory therapist. I gave nebulized morphine to a sweet old lady who was passing away very painfully in front of her family. There were about 12 of us in the room, including me, the PA for the pulmonary group that was covering the ICU for the weekend, that ordered it, and her family. 12 of us in a tiny room. I didn't think about it at the time because I was very concerned about it being out of my scope of practice, and because it was the weekend, I didn't have a chain of command to really ask. But, nebulizing an opiate in a tiny room with a lot of people, when the PA and I came out after 4 minutes and the treatment was finished, I said I felt kind of funny, and the PA laughed kind of weakly, then sat down. My pupils were pinpoint. We also used to nebulize vodka for pulmonary edema, although I've never done it, so can't vouch for it. Story 4. It was a while ago, but when I was a physician in the military, I prescribed Dapsone, among a couple other unusual medications, for a case of Hansen's disease, aka leprosy, that a Marine had contracted in the Middle East. I was on the medical team caring for the patient, but I remember orthopedics being heavily involved because somehow the disease was in the bone. For those wondering, in the West, while leprosy is a disease people hear about because it's mentioned often in history, it's something you learn about once in medical school and almost never see in civilian practice. I'd also add I was not the person who made the diagnosis, I just did what I was told by my attending. I was an intern. Story 5. By far not a doctor, but a relative of mine had a lot of problems with allergic reactions, especially on the skin, where weird-looking welts would form. After about a year of trying out treatments, they eventually used a medication of which the basic components are ovaries of a hamster. They had to repeat giving him those syringes a few times, but then it was successfully treated. Sounds like urticaria hives, which is an allergic-type reaction. Omalizumab is a drug that can be used to treat it and is produced in bioreactors from Chinese hamster ovary tissue, like a lot of other similar drugs are. It works by blocking IgE receptors, therefore reducing histamine, so it's an indirect antihistamine. Story 6. A long time ago, about 30 years, before I qualified and was still in school, we had a patient on the internal medicine service that was suspected of having sarcoidosis. There was an old test called the Kveme test, aka Kveme-Silbach or Kveme-Nickerson, which basically the test involved injecting a small blob of material taken from the spleen of a patient with known sarcoidosis into the skin of a patient suspected to have the disease. If non-cessating granulomas later form there, 4 to 6 weeks later, then the test is positive. The patient has sarcoidosis. It was a finicky test and subject to false negatives. There's also a huge risk of transmission in other diseases since you're injecting part of another person into the patient. Story 7. When I was a travel nurse, the nurse next door to me had a patient who was bitten by a rattlesnake. Was in pretty bad shape by the time they made it to the ICU because they were hiking in desert rural nowhere when it happened. The 2 pharmacists, which are already unusual, brought the antivenom down to the unit like they were holding the keys to the Ark of the Covenant. Seriously, they were walking slowly, and one of them holding it, and the other was holding their hands underneath it. Turns out the cost was something like 40 grand a vial, and the patient needed 3 total. I didn't give the medication, but it was one of the most interesting nights I've ever worked in the ICU, and that's saying something. Story 8. It was many years ago, and I was working with end-stage cancer patients. This one woman who began her treatment outside of the US was giving a mixture of propane, heroin, alcohol, morphine, phenothiazine, and some other antiemetics. It was specially made into a liquid and imported from somewhere in Europe. I remember this med so vividly because it's not every day you give someone heroin. I think it was called something like Brompton cocktail, and the lengths that were gone to check out and administer a dose of that stuff, we're talking about who's got the nuclear codes type of system. I have to admit though, it worked like magic. Story 9. My coworker had to use something called hyaluronidase recently. It's given sub-Q when vancomycin infiltrates in an IV, meaning that it gets out of the vein and starts pooling in the local tissue. Vanco is toxic at high levels, and it kills the tissue. So when this happens, you have to give multiple small doses of this drug with a tiny needle into the surrounding tissue to break down the vanco and save the tissue. Hyaluronidase is also used to dissolve bad face fillers, lip filler and stuff, if they turn out wonky, or more seriously, if they're injected into a blood vessel, which can cause necrosis. Story 10. Methylene blue. I gave it to a girl who tried overdosing on Orajal. This active ingredient is benzocaine, which caused her to develop a methemoglobinemia treated with the blue drug. It truly is an artificial-looking bright blue, and I gave it to her in an IV. Pharmacist here. That showed up a few times as a drug, which always made me chuckle because for so long in my head, it was just something used to stain bacteria. Now I use it to stabilize technetium 99M exemedazime. Methylene blue really has run a wide gamut as far as spheres in which it's found use. Story 11. I've gotten rattlesnake antivenin 3 times. Basically, my former hospital would stabilize the bite by giving the initial doses of antivenom in the ED, then send them to my unit. Then I would base the decision for additional doses on my assessment of any symptoms, plus a call to poison control, plus written protocol. It was interesting and scary because after the protocol was initiated, it was up to my nursing judgment whether to give more antivenin or not, which is how any protocol works, but it was just weird following one with such an uncommon and expensive, over $3,000 plus per med. Story 12. As a nurse, I'd say working with milrinone, a continuous IV med to treat heart failure. It's a last-ditch effort. They have to wear a pump constantly, and if it stops infusing, you have just a few minutes to get it going again. Otherwise, their CHF symptoms hit suddenly, and you better be on the phone to 911. Did not enjoy it. As a vet assistant, wasn't an actual registered tech, vodka IV for a cat that drank antifreeze, just straight vodka. I'm a licensed vet tech. We keep high-end vodka in our Omnicell for this reason. Only ever seen it used once, though. Story 13. Not me, but a colleague doctor. A patient of his, an old lady, was not long for this world, and her breathing was starting to fail because the nerves to the respiratory muscles had stopped working. Her family were on their way in to say goodbye, but having very little time left, the doctor had to do something desperate. He had a fridge, and in that fridge he had a drug that had been discontinued for years, but for some reason he had saved it. Dude gave her 1 dose, enough for her to be able to breathe and say goodbye, which thankfully she could. Absolute mad lad he was. Story 14. Tuberculosis to treat bladder cancer. Not in healthcare, but my grandfather has bladder cancer, and one of the recent treatments was injection of TB. I have no idea why. I just know it didn't work. I worked with a guy who had this done. It was administered via the urine catheter, not IV. So apparently it causes the bladder cancer to be surrounded by fibrous scar tissue and slowly destroyed. As the TB has difficulty leaving the bladder, it just attacks the cancer and dies out after. Story 15. Maggots. We had a drug addict come in who had let an infection go so long in his arm from repeated needle usage that all our attempts to clean it failed. We ended up using maggots to eat away the dead tissue, while leaving the healthy tissue intact. Dude just had an open wound full of maggots loosely covered in some gauze for like several days. The worst part is always having to collect them afterward. The medication most people are shocked by is cocaine hydrochloride. Yep, cocaine. It's a good vasoconstriction agent and topical anesthetic. Story 16. In 15 years of hospital pharmacy, I've twice had occasion to dispense thalidomide. It's used as an end-stage anti-nausea med and comes very carefully packaged, with all sorts of warnings about not coming near it if pregnant, and even has little pictures of thalidomide babies. My dad was one of the few in Norway affected by thalidomide, and he got off really lucky with just some missing and very short fingers. Could not get into the army despite being a good shooter. Any damage to the other hand would render him disabled, and the army would not risk it. Story 17. Obligatory not a doctor, but I realized recently I was laboring under the delusion that fentanyl was 100% illegal when I was given some in the ICU. Let me tell you, that gave me pause in the middle of a high fever. When I was getting a colonoscopy, I remember the drugs they gave me said fentanyl, or had fentanyl in the name, on the vial, as they were administering it to me. I was like, that's interesting. And then 5 seconds later, completely messed up out of my mind. Story 18. Demerol used to be a fairly common pain med, but it's rarely used for that anymore. I used it once in the ED for this weird, intractable tremoring that was thought to be a side effect of an experimental cancer treatment. Only used it because the oncologist asked. That was kind of interesting. The pharmacy called me and thought I had lost my mind, until I explained. Also got to give dantrolene for post-anesthesia malignant hypothermia. It's on all the tests, but outside of maybe anesthesia, you don't see it. So that was cool for me as well. Story 19. A poop fecal transplantation. At my first internship during nursing school, there was a patient with a bowel infection caused by Clostridium difficile. A few months before, he got treated with broad-spectrum antibiotics for pneumonia, which caused the infection. They tried other treatments to cure the infection, but nothing worked. Eventually, the patient got accepted in a clinic trial for a fecal transplant. One of his kids was the poop donor. After the transplantation, the infection actually cleared up. Story 20. Synthetic blood. Melbourne, Australia, and I think it was the world first at the time. We had a trauma patient who required a blood transfusion. She couldn't accept blood products, however, due to her religious beliefs, so synthetic blood was shipped in from the US, ended up saving her life. We hadn't heard of synthetic blood, so it was kind of bizarre. This was a few years ago, so I'm not sure if it's more widely used now, but I've not seen it since. Story 21. Whiskey. I had a patient with dementia who used to drink 1 glass of whiskey every night before bed for the last 40+ years. She wouldn't settle at all without it and became a huge fall risk as she broke her hip a few weeks earlier and was struggling with her mobility. We had a doctor prescribe 25 milliliters of whiskey once per day and had a bottle brought to the ward for her. It was funny signing it off on her meds chart every night. Story 22. I'm only a pharmacy technician, but we had one patient who needed a hydrochloric acid drip, if I remembered correctly. I had never seen it before, and the pharmacist had to make sure it was a metal container and delivered via a reinforced line, maybe glass. It was a long time ago. Aside from that, the rarest drug I've actually had to compound has probably been K-Centra prothrombin complex concentrate for bleeding. Story 23. Former pharmacy technician. In our narcotics safe was 1 5-milliliter vial of pure opium tincture. Once a month, we would dispense 1 milliliter to a patient who was going through intense chemotherapy. Third or fourth line for refractory diarrhea, particularly for chemotherapy-induced diarrhea. Really confused me the first time I saw an order for it. Story 24. Ex-theater nurse here. There's a rare condition. It's a rare condition this day and age. I couldn't resist. The Family Matters theme song is so good. There's a rare condition called malignant hypothermia, which is essentially a severe and life-threatening reaction to anesthetic drugs. The antidote is dantrolene, which is bright orange, expensive as frick, and kept on site at all times. I'm pretty sure there's a relatively small amount distributed across my state. However, since this condition is so rare, it often just expires. Story 25. Not me, but one of my nursing professors told the story of an alcoholic who was so deep into his addiction that the doctor prescribed a cup of wine every 8 or 12 hours, or something like that, to keep him from going into fatal withdrawals. Naturally, the hospital did not spring for a nice one. The same happens with GHB addiction in my country. The addict himself has to bring in the GHB needed to taper. Story 26. Not a doctor or nurse, but analytical chemist for a small-scale bespoke pharmaceuticals production company, had to stock control our CDs, control drugs, and dispose of about 10 grams of out-of-date pharma-grade cocaine hydrochloride that had been used once. Apparently, it can be prescribed as a mouthwash for numbing the gums. Story 27. I had a woman who was on ziconotide, which is an analgesic derived from cone snail venom. If it wasn't administered correctly through the spine, it would cause hallucinations. At some point in history, a scientist was like, "Oh, darn it, whether I snort, drink, inject, or jam this cone snail venom up my butt, I always hallucinate. Bob, get over here, put it through my spine." Story 28. Pharmacist here and leeches. We use them to keep blood flowing if you get a finger or ear or something cut off and sewn back on. I was told recently that a medical-grade leech cost $42. Also, clinicians should not bring their own from home. I would have assumed that went without saying, but apparently not. Story 29. IgG. It's hella expensive and only necessary for certain autoimmune issues. I think I gave it to Guillain-Barré syndrome, but this was like 6 years ago. Each bottle is $20,000, I think. My son has had IVIG 5 times at $25K a pop. He now takes an immune suppressant that costs $1,200 a month that seems to be holding him. Thankfully, we're Canadian. Story 30. I once had to administer a certain type of blood product to a patient with an immune disorder. Each dose was worth £5,000, and he needed 3. It also was in a complicated setup. If I set it up wrong, it would be a waste and unusable. Long story short, I administered it okay with the most anxiety I've ever had in my 6-year nursing career to date. Fun times. Story 31. Melarsoprol for trypanosomiasis, sleeping sickness. Arsenic compound was shipped directly from WHO headquarters to us. The patient had to be loaded with prednisolone due to toxicity, and we had to remove the peripheral catheter after each dose, since it supposedly would react with and destroy the plastic. Totally wild. Story 32. I had a wealthy patient who paid $70,000 on his Amex Platinum card for a 1-month supply of Harvoni, Hep C, for him and his wife. That was not even enough for full treatment. That was the cost every month for 3 months. He told me he had gotten Hep C from an escort. That is one expensive romp he had. Story 33. Medical maggots to chew up the dead tissue off a diabetic patient's foot. I was an intern when my attending wanted to use maggots on a patient. The nurses refused to change the dressing and would page me to do it. The PT said he would hear chewing in the middle of the night and that his foot kinda tickled. Story 34. Activated protein C. Can't remember exactly, but it was about 50K pounds a dose. Used in severe last-ditch sepsis treatment. Not a vial you want to drop. Xigris. Had administered it as well in the US when working in a critical care. It was pulled from the markets here in 2012 or so. Like how that Today sponge was discontinued for birth control. And then Elaine from Seinfeld was determining whether someone was sponge-worthy enough to sleep with. Story 35. Glucarpidase for reversing methotrexate overdose. Was a witch to give, as there was unclear instructions. Had to be ordered specially from the pharmaceutical company and wait for delivery directly to the ward. If I remember, it was about 50,000 pounds for a 2 milliliter dose. Story 36. I take GHB, as in the date grape drug. It's called Xyrem, and is used for narcolepsy. It also costs $10,000 a month without insurance. Bloody hell, I never knew grapists were making such a financial commitment. Story 37. I work in cardiac surgery. I've had to give prothrombin complex concentrate to reverse anticoagulation. It's like $6,000 per dose. Prothrombin complex sells for $337 in India. Quite a difference in price. Story 38. Not a nurse or a doctor. I didn't have to administer anything myself, but a friend of mine went to hospital feeling awful and was diagnosed with scurvy. The doctor treating him got all the students to come and look at him as it was so unusual. UK. Story 39. Botulinum antitoxin. Cost about $15K 20 years ago. The vial came from the CDC and contained 4 doses. The nurse delivered the first dose and threw the rest away, not understanding there were no other single-use vials. Story 40. Not a doctor, but as a kid, I had horrible migraines that upset my stomach heavily. My pediatrician medicine for that? Lukewarm Coca-Cola. Now I realize it was a way for me to burp instead of throwing up. I love that medicine. Story 41. Some metabolic diseases are extremely rare, but can be treated by replacing whatever enzyme is missing. I've prescribed idursulfase for Hunter syndrome. It was something like $250,000 per month, and was covered by the state. Story 42. NICU nurse here, Ammonal. I've had to give it to 2 different patients. It's a medication to help with really high blood ammonia levels with kids who have certain metabolic conditions. The medication is extremely expensive. Story 43. Was a traveling nurse in Arizona years ago, had a kid stung by a scorpion. They flew in an antidote from NIH they were developing to give to the kid. I didn't give it, the doctor did. It was treated like some kind of liquid gold. Story 44. Vodka because of methanol poisoning. I was going to say the most surprising thing I saw in the fridge in the med room was a can of beer, labeled PRNQD, and chilled for the patient. Story 45. Cocaine baby for a bad nosebleed. Wait, what cocaine stops nosebleeds? I got a pretty bad nosebleed during allergy season. Maybe I should try cocaine. Story 46. Probably the hemophiliac medications. There was one that ran in a family and required medication to be pushed IV, 50 milliliters, 1 q6 seconds. Story 48. Teradol, funnily enough. They give it out like candy in the ED, but I work in the cardiac ICU, and it's contradicted in most of my patients. Oh man, thanks for sticking with me while I struggled to pronounce a lot of these medical jargon blah blah blahs. Please leave your stories in the comments. I'd love to make a video of them in the future. Also, don't forget to like and subscribe.